good afternoon, or good evening, depending on where you are in the world. And thank you very much for joining us today. It's a great pleasure to welcome all of you for our COVID pandemic in Africa roundtable discussion. To discuss the current state of the pandemic in Africa, the communication strategies that have been deployed on the continental but also country level, and reflect on the public understanding and the impact of fake news. Today we have with us as a speaker Dr. Olivia Namusisi, Dr. Bobadoye Ayodotun, and Sally Deffor. We are also honored to have Professor Morenike with us today to moderate the discussion. She works at the Obafemi Awolowo University in Ife in Nigeria. Today's event was organized by the African Professionals for Progress Association, which aims to create a global network of highly skilled and trained individuals in Africa, the from the diaspora and also Afro-descendants, to leverage know-how, knowledge, and skills to benefit the continent and also people outside of the continent. We were working in collaboration with the Public Learning and Understanding of Science subfaculty of the Global Emerging Pathogen Treatment Consortium, which has for goal to promote good public knowledge around the epidemic through promotion and creation of media that are easily understandable by the large public. Before I give the floor to Professor Ukong, I would like to give you some guidance. So please, if you have questions, use the webinar chat. We will be taking on it, and our moderator will come back to you on those. And please accept our apologies in advance if we do not manage to reply everything to all your questions today. So on this note, I leave the floor to Professor Morenike.
Thank you very much, Nana. I once again want to join Nana to welcome every person here. I learned that there's a diverse audience that registered for this. We have journalists, we have laboratory scientists, we have epidemiologists, and medical lab scientists, public health specialists. We also have students. So I hope this will truly be a learning experience for you. This is one of a number of series of webinars that we'll be holding, and we hope this will be strong enough to bring you back to our next learning. I'm sure you do appreciate that this is focused on Africa. We'll see that what's happening on Africa is not typical of what we've seen in Europe and the US. We do also appreciate the role of communication in making a difference. What we've seen is a late steep rise in the number of cases with COVID infection in Africa. But one distinct thing we have noticed when we compare with UK and Europe is the low number of deaths, and many people are curious about this. We do appreciate that there are gaps in terms of recording these numbers, but otherwise this our continuous engagement and deliberation will help us understand better what's happening on the continent and the roles that you and I can play in improving the response so far. Like Nana did share with you, we have 3 brilliant speakers that will take us through our understanding of what's happening in the field with extensive focus on communication. And then we will open up the space for your chats and your questions. Please, once again, put your questions in the chat box. We will definitely get there and deal with that. One of the things that you will see peculiar with this is that even as we're continuing the engagement, we would be going to the chat box and you will be getting your questions answered. Our first speaker will be Dr. Olivia Kasenge, who is a medical epidemiologist working as the Regional Technical Coordinator for the African Field Epidemiology Network in East Africa. She brings experience to the table, and we're hoping to learn from her. The next speaker would be Ayodotun Bobadoye, who is the Chief Operating Officer of the Global Emerging Pathogens Treatment Consortium. And you might have heard a lot about GETS because of their brilliant response with Ebola, and therefore being very well prepared to address COVID. The lessons they've learned from Ebola, they would definitely share with us, and how they have been applying it successfully with managing COVID in Nigeria, but also along with their partner countries. I know they've worked in Sierra Leone. And then third but not the last, I will also have Dr. Sally Deffor, who is a media and communication practitioner and a researcher. And that's the brilliance she's bringing to this field, to this webinar. She's from Ghana with over 10 years experience in international development field, and I've worked across Europe, Asia, and Africa. And therefore, we will be hearing from someone who is objectively opinionated about what might be happening across the field and what we have to do in terms of communication. Once again, I welcome everybody, and please note this is a learning platform. We would want to hear from you. We're not having everything. I mean, we don't know everything, so I'm facilitating learning from you, and include discussions, include questions. At this point, I would like to hand over to Dr. Olivia, who would start our discussion. Olivia, you're welcome. Nana, please unmute Dr. Olivia. Thank you.
Thank you very much, Prof. Monerike. And I'd want to lead a discussion on the response of COVID at continental level, basically focusing our discussion or conversation on who are the key players, what are the actions taken, and the coordination we see between the countries. Thank you again. My name is Olivia Namusisi, and I work with Affinet. And I'll lead the conversation on this. So what I have to say and what I see is Africa is still in the early stages of the pandemic. However, many countries across the continent have taken drastic steps to get their systems ready, somehow ready, and to manage the cases as they build. But that said, we still have challenges and big challenges. And we are concerned about the increasing cases in several countries now. So all effort is to ensure stewardship is by the governments. The overall response should be led by the relevant sectors of the governments, what we are calling an all-government approach. So who are the key players in this? There are several. We are lucky to have many people out there willing to support the continent. There's an African Union task force on COVID, and other regional bodies like the ECOWAS, WAHO, the EXA, the East African Community, several universities and research institutions, and they're all coming in to augment national efforts. What do we have in the public health space? We have WHO. They're helping us, or they even came before we saw the first numbers on the continent. They came in to help us building capacity to prepare continents. They helped them write their preparedness and response plans. They helped them to do their resource mappings, but also training people who will later support the outbreak. They helped us categorize countries depending on the risk, because they did a risk assessment. We had several categories, category 1, category 2, category 3, depending on what they saw and how they saw our cases coming into Africa. And this basically, most of these categories was based on travel, people who have access to those countries from elsewhere where cases were coming in. Now, the support we are seeing from the WHO is basically helping us organize our situation reports, providing situation updates, providing technical guidance as the information becomes available. We have online platforms, we have materials, guidance, they have prepared in the several areas. WHO has also helped deploy experts to support incident management teams of the various governments. And this is being very vital in most of what the countries are doing. We have also on the globe, the Africa CDC. They are providing a lot of technical support. They're helping to link public health emergency operating centers to share experiences from the various countries and information, across the region. And they're also helping ready teams, trained teams to respond, especially the rapid responders. We have Affinet, the organization that I work for. We are engaging various field epidemiology training programs to support the response at national and subnational level. The US CDC has been very generous. They're helping us with the testing capacity. but also epidemiological guidance. We have other sectors like the UNICEF, IFRC, the national societies, MSF, and many other NGOs within the countries. Currently, there is also an ongoing solidarity flight delivering life-saving supplies to a number of African countries. And this is a collaboration between WHO, the African Union, the Africa CDC, the World Food Programme, the Ethiopian Airline, and the Jack Ma Foundation from China. These have really been very instrumental in helping us to fight the pandemic. We are also having a number of universities and research institutions supporting our readiness. We have research into clinical cause of the disease. Information is increasingly becoming available. Research into factors for severe diseases in the African context, especially the impact of the comorbidities on the outcome of the disease. We're also having people modeling to derive projections on expected caseloads, looking at mild symptoms, severe symptoms. That also helps us, again, to ready our systems in terms of capacity. We have human resource, you have patient bed capacity, ICUs, oxygen concentrators. And I must say, the slow moving of the hurricane into Africa has helped us buy time so that we can, learn from the other countries, but two, get ourselves prepared the best we can. There are also collaborations on vaccine trials and therapeutics. So again, we have a platform to start from. There's ongoing research into the economic and social impact of the pandemic to engage and advise governments on strategies to revive our national economies. Again, I must say I'm happy that there is also guidance, increasing guidance on considerations on how to begin lifting, restrictions. We want these lifts to be guided by science or by experiences we are seeing from other countries, so that we don't get, a spike once, we take things very fast. Other sectors, the media is increasingly providing credible information to the public. The telecom companies have come in to be very helpful to disseminate information to those areas without internet. Travel companies are helping distribute medical supplies to ensure they reach countries across borders quickly and safely. And I must say, countries are working together to enable some of those things happen. Much as most countries have closed borders, there are those key sections that are open and are beginning to be helpful. Again, I must say, no single country has everything in place. We are all in this together. We need each other's support, and we are working more than ever before together to learn from each other, share experiences. The continent is generally taking the pandemic very seriously, with very many countries implementing travel restrictions, including lockdowns, and institutions instituting strategies to control the spread. There's a lot of information among countries, sharing experiences, but again, there are several myths, but we shall speak to that later. I don't know whether my colleague Ayodotun wants to add to that, but I think that's what I see as our support across the continent. Over to you, Prof. Morenike.
Thanks, Olivia. So we'll hand it over to Dotun. Dotun, please go ahead.
Yeah, thank you, Professor Mo. And I think I'll just go straight to risk communication. Maybe after the presentations, we have enough time to discuss. Yeah, risk communication is very important when we're thinking of reducing the spread or containing any form of epidemic, not just in Nigeria or in Africa, but in any part of the world. How well people respond to any epidemic or pandemic depends on how well you can communicate in such a way that people can understand, digest, and take informed decisions. So the first question is, what is risk communication? Risk communication can simply be defined as exchange of real-time, accurate information, advice, or opinion between experts that have a clear understanding of what is going on and people that are facing the risk. And the purpose of risk communication is for people to understand and be able to take informed decisions based on what you have communicated to them. So you can't say you effectively communicate to an audience or to a set of people during an epidemic until they have a clear understanding of what you're saying and they're using what you're saying to take informed decision. Take, for example, for COVID, if you're saying people have to wash their hand, the way you communicate that to somebody that lives in DC is different from the way you communicate that to somebody that lives in Kibera in Kenya, or somebody that lives in Ajegunle in Nigeria, or people have to wear face mask, or people have to stay at home. You'll be able to communicate this information in such a way that they will understand, they will digest, and they will see a reason why you are giving them such instructions and act based on what you've told them. So this communication, there is no particular way of doing it. You can use every medium, from social media to using pastors, to using town criers, any form, any way you decide to use it. The whole essence is that it can influence people's perception, and based on the influence, they can take decision on it. And risk communication during COVID is relatively complex. Why is risk communication during COVID complex? Because COVID is the first pandemic of its size that we are seeing in modern human history. I don't think there's anybody living on the surface of the earth that have seen a huge health challenge that within 4 months has moved from a small reported in over 200 countries and territories all over the world. COVID has infected over 2.6 million people, and about 285,000 people have lost their life as a result of COVID. So this is new to everybody living on the surface of the earth, and everybody from the best of the experts to the least. We are all trying to understand this new pandemic that is ravaging the whole world. And because it's relatively new, everybody is struggling to understand what COVID is, and that makes communication relatively complex. Number two is that this is the first global pandemic we'll be experiencing during the social media era. And this COVID has shown clearly the impact of social media, on epidemics or global issues, both on the positive and on the not too positive way. In fact, somebody said we are not just fighting an epidemic. We are not just fighting a pandemic. We are fighting an infodemic. Fake news spread as much, if not faster than the correct news, and is as deadly as the right information. We've had people that have listened to fake news on COVID and they've lost their lives. In fact, fake news is destroying as many people as COVID itself is destroying. So this shows the importance of communicating the right information, using the right medium, and making sure that people have a clear understanding of what you're saying and use what you're saying for decision making. So how do we communicate risk during COVID? Number one, you have to understand that risk, you can't effectively communicate risk except to get the communities involved. Series of epidemics, especially the Ebola virus that happened in West Africa some years ago, we discovered that top-down risk top-down communication does not really solve epidemics. And stakeholders vary. Those that are stakeholders in the developed world, in a country like Nigeria, an influencer may be the pastor. If a pastor that has a church of like 5 million people says there is no COVID, people will believe their pastor more than they believe the health minister of the country. So you have to understand your influencers and your stakeholders, and you have to have the ability to carry everybody along and make sure that everybody is speaking the same language to the same set of people. So that when people listen to the same language from the Minister for Health, from the government, the pastor tells them the same thing, the traditional rulers tells them the same thing, they take it serious and they understand the reason why they have to do what you ask them to do to reduce the impact of the pandemic. And number two is that during a pandemic, you have to understand your audience. You have to know your community clearly. Have a clear understanding of people you are communicating to, and communicate in such a way that those people will understand what you're saying. It's of no use going to let me say, Kibera, where a lot of people speak Swahili, and just go there and go and speak Queen's English to explain COVID, and you think you've communicated and you leave. No, it doesn't work that way. You have to understand the community. You have to understand the school system, the faith-based system in that community, the healthcare system in that community, the job system in that community. All these things have to be put into consideration for you to understand their psyche and to be able to effectively communicate with such community. And second is you have to understand your message. Everybody, there should be a clear source of message where everybody takes information from, and everybody should be speaking the same language. Like for Nigeria, we have the NCDC, Nigeria Center for Disease Control. That should be the center for COVID information in the country, and different countries have their own too. So A should not be speaking something different from what B is saying. Everybody should have a clear understanding of the message. And if the message is changing, everybody should change at the same time. Everybody, the influencers, the stakeholders, should be speaking the same language at the same time, and make sure that everybody is passing the right information across. Number three is know your own capacity and capability. Don't over-exaggerate. Just give information the way it is and the best way you can give it for people to take informed decision. So risk communication and community engagement is critical, is a very critical component in the response to any infectious diseases. What a disease looks like in a community depends on how well you communicate that disease. And if you don't communicate the disease effectively, then people will not be able to take adequate steps to contain or to reduce the impact of the disease in the community. Take for example, the COVID-19. We've had different sources of information, especially on social media, people giving different kind of treatment procedures. Everybody has become a doctor. Everybody feels he can say what he feels like saying. And of course, on the social media, there's nobody regulating it. So another thing is that we have to have a clear understanding of what is going on different platforms, from social media platforms to the organized or newsletters and things like and newspapers, so that we can follow up every fake news, because fake news is as deadly as the virus itself. We must follow up the fake news and make sure information as possible. So to conclude, risk communication, especially in a continent like Africa, where we have high level of illiteracy, is very important in solving this COVID-19 pandemic. Let me stop there. Thank you.
Thank you, Dotun. Thanks for that brilliant practical illustration of what it means to communicate risk, including what it means for COVID. We'll go on to Sally, and then we'll take it forward from there. Thank you.
Thanks, Marinike. So yes, I will speak to the issue of how Africans are engaging on social media around COVID-19. I would say that the trends in social media engagement around the virus mirror that of other parts of the world. And this is not surprising at all, because for the first time since maybe forever, we are unified in that we are tackling the same issue. About half a decade ago, Ebola was a West Africa problem, and even more recently, it was a DRC problem. But now everybody is being confronted by COVID, albeit at different scales for the different regions of the world and the different countries. So in a way, what we are engaging with, the content and how we talk, is almost similar to other parts of the world. It runs the gamut. It's from the really, really serious and the really, really technical and scientific aspects of the virus to the mundane, like memes and funny stuff about how people are managing the lockdown. So we see quite a lot of engagement from Africans, not only on the continent, but also in the diaspora. Some people are actually attempting a deep dive into the data that is coming out. And that has been really, really refreshing to see. So we've seen quite a bit of engagement around, first of all, I'll start from the national level. Some countries in Africa, and I'll take Ghana as an example, have got the presidential briefing that goes on, I think, once a week, and sometimes from the press secretary, also from the Minister of Information. And so those are opportunities where you get updates on whether you're going to remain at home, or whether there's going to be quarantine in place, or there's going to be curfew in some parts of the country. And often you see that everybody looks forward to those briefings, and soon after those briefings end, you see quite a lot of engagement. You see people sort of dissecting the issues to see the facts and how they play out. People are also discussing the government's response to it, and we've heard from Olivia and we've heard from Ayodotun about what specifically is being done in terms of from the scientific point of view, but also from the information point of view. So we've seen quite a bit of engagement around, at the national level, around what people see as government response. And here I have to say that of course, quite a few of that has political and religious undertones, and I'll touch on that in a little bit. But also we've seen at the global level, people engaging with what the disease is. So we've taken what we know from WHO, from CDC, from when it started in China, and then of course moving to Europe and now to the US. We've seen people trying to understand the disease. So a lot of the engagement is around, and this is where misinformation, or what we call fake news commonly, comes in. And so, of course, here we have to then talk about the elephant in the room, which is conspiracy theories. You see quite a lot of that also being discussed. And that is not just an Africa problem, sadly. So that is the extent, I would say, about what is being discussed. So of course, now with COVID and of course with social media, we are seeing quite a lot of videos and also a lot of pictures about what the disease is, but also quite a lot of technical documents. Now I think more people than ever are taking the time to read the content that they see on social media, which is both a good thing and a bad thing. And so moving on to the fake news and what it is, and of course, misinformation and the ramifications of it. Well, of course, social media and fake news have all in Africa predates COVID. We've seen it play out in elections with either incumbents or oppositions trying to, get one up over the other through, of course, putting stories that are true in the public domain. But this has become very magnified in the times of COVID. And I think this is because we are in completely uncharted waters with COVID. Nobody knows what this virus is, so there's a lot of unknowns. And so when people don't know a lot of stuff, that is room for people to speculate. And so they try to make up stories, sensationalize stories, and that is why fake news or misinformation is so magnified now. Another reason why we see it being particularly challenging at this particular time is because of the rapid distribution of information. Every day, I think nobody's talking about anything else but COVID all over the world. So if you look at the content, some stats coming out of Facebook, sheer staggering amount of information that comes out on our social media platforms about COVID is so much that even the best of us who do quite a bit of due diligence on news to examine if it's fake before. Now we simply don't have the time. We have to read first and share it first before we even begin to explore if it's actually true. So these two, I'll say, are the reasons why, as Dotun referred to it, it's now being referred to as an infodemic. So we are fighting two things here, both pandemic and infodemic. And the fact is that the infodemic sort of, the trajectory of it and how it's evolving sort of is almost like the disease itself. So you see some of the fake news are quite mild, as some of the diseases are, and some of them are quite serious. Dotun has touched on that some of them are a matter of life and death. If you have people thinking that you can drink bleach and of course it will clear your lungs or your throat, then of course you have people who are potentially going to die from even disease unrelated to COVID. But then of course some of them are also quite mild. You have people, there was a story about if you have to hold your breath for, was it 10 seconds? And people were practicing that. At the very least, you get some breathing exercise and you're probably not going to die from that. So you have quite mild impact of fake news and you have quite serious ones. And that is the challenge to tackling the disease on the continent. So then you then begin to talk about, well, what role does politics and religion play here? And that is something you cannot ignore on the African continent, because well, we do, you know, put our religious leaders on a pedestal. Whatever they say, we do take it quite seriously. And so that is why research has established that most of the fake news or misinformation that is distributed and is shared, well, you find that it comes from one, of course, such religious platforms, but also it comes from family, with our older relatives being the worst culprits. They are sharing stuff on family WhatsApp groups that we have completely no control over. But the good thing is that, of course, that with social media, the social media giants, namely Facebook, Twitter, Google, they are all doing quite a lot. And so so they're already a step ahead of us in fighting this the pandemic of fake news. And I'll begin to, you know, sort of start addressing some of the questions that have come in prior to this. And I'll tackle, first of all, the question coming from, I think it was Tom, who was referring to how we can ensure that public officials and health authorities sort of have that two-way communication with the public, so that the information that they're getting, they're able to sort of, you know, ensure that they communicate and it comes across quite well. Well, we are seeing that social media sort of opens up that space for that to happen quite nicely. We've seen some officials, even the WHO head, engaging with people, responding to tweets. So that I would say that social media is a space where this kind of engagement can happen. And so when we begin to talk about how we can fight the pandemic, I would say that that two-way communication is quite good. And the fact that we've got the social media giants coming in, and I'll just leave it here for now, and then we can tackle some of those when we start to look into the questions coming up in the chat. Thank you.
Thank you so much. Thank you, Olivia. Thank you, Dotun. Yes, and Sally. Thank you so much. We're going to open this up to questions. I would read some. There's been some Q&As and there's been discussions as well as suggestions. I'll throw that to you too. And thanks for also answering some already. We have a question here. Someone, Amza Aliyu, is very concerned about the low engagement of our academia in terms of addressing this pandemic. Olivia, would you like to highlight, if possible, what gaps that you have noticed in your work in the field in terms of academics' contribution to the response, and how we can make this better in terms of ameliorating the impact of COVID-19? Thank you. Nana, please would you unmute Olivia so that she can respond? Thank you. Olivia, you can unmute yourself.
I think I've unmuted myself. Thank you. Thank you for that question. I know, like I said, there's a lot of research going on in the academia. Unfortunately, as of now, the information is in a few sectors. It hasn't trickled down to where exactly we want it. Most of this research is the feedback. The direction of communication is basically within the health sector, academia, and the health sector, and very little of it is yet to trickle down to where information is needed the most, where misinformation is doing a lot of havoc. But again, you'll excuse, this is a new disease, a lot of information is just beginning to become available. And even before they take it down to where it's needed to the grassroots, a lot of synthesis has to happen. Even the medical people have to understand the information before they can, digest it into simpler language that is going to be understood by the wider community. So that's the bigger challenge. What can we do? We need to make a lot of translations from science to the language that people understand, so that factual information, and probably that's why there are many myths right now, because we haven't opened up so much to get the information trickled down, because also the medical fraternity is just in the process of understanding this information more and more. Even, there are many questions also still in our heads that haven't been answered every day. We just have to go on and research and read papers that are becoming available. There's a lot that needs to be known. There's a lot of research that still needs to happen. And there's a lot of work that we need to do on our part to translate this information into easier language for the public. And that is ongoing, and it's going really fast, I must say. But we just need to be patient again. Much as the disease is spreading, again, we want to produce information that people understand. So the speed is there, the translations are happening. Probably it's not enough, and a lot more needs to happen.
Thank you, Olivia. Sally, I have a question for you, and then I'll ask Dotun also to complement. There's no denying the fact that this pandemic and lockdown, we've had a lot of social media users suddenly become experts in reporting COVID issue, and Dotun, you highlighted that. Sally, please, how can media professionals break down the impact of fake news on the social media, as this is proven to affect the decision of most people to either conform or not conform to what the government, to government's directives? So Sally, please, and then Dotun, please complement the response.
Right. Yeah, thanks for that. Well, I've always been a media researcher and practitioner. I've always been a big, supporter of the role of media professionals. But in these times of COVID, I will have to say that this is a task that media professionals cannot take on their own. And I'm saying this because, like I said, there's quite a lot we don't already know about the disease, and there's just too much information going out there that media professionals cannot simply be the gatekeepers of what is factual. So here, of course, I've mentioned about the role that the media, social media giants themselves are playing. And so that is really great, but we also need to be checks on each other. And I've seen that happen from my monitoring of social media platforms. We've seen people, families, friends calling out each other on fake news. And so everybody becomes a media professional. And I'll say that is the way to go. So this is something that, well, media professionals can simply not take on. And so everybody needs to become some kind of watchdog. And that is the only way we can fight the spread of the disease as much as the epidemic.
Thank you, Sally. Dotun, would you like to add something to that?
Hello, can you hear me?
We can hear you. You're breaking though.
Okay,
we can hear you. Yes, continue.
Okay, I think the best way to reduce the impact of fake news, especially on social media, is to create official platforms for official COVID information, not just at national level, at the state level, at the local government levels, and even at the community levels. so that everybody will know that anything that I read on social media platforms, I have to go to these official media platforms and go and see if it's correct or not. Once we create these platforms and everybody knows that, okay, there's a place to go to confirm whether the information about COVID is true or not, then it will be easier for you to at least reduce the impact of fake news. But if not that, a lot of fake news come in almost every second. And once you don't have official platform to say, okay, at the national level, this is what they're saying. At the state level, this is where I can get information, both on online information, both newspaper information, both radios and things like that. Just make sure that you continue to put the right information right there in such a way that everybody understands, in the language that everybody understands, and create platforms at every unit where people can confirm whether an information about COVID is right or wrong.
Thank you, Dr. I think in summary for that question is that we must have trusted local sources. We have people who learn from the national, translate that into states, structures or regional structures, and then that also gets translated and communicated. We have every society have effective communication mechanism. We need to ride on that. It has always existed. It is not COVID that is going to create it new. We must, that is why Dr. said initially, and if you listen to the speaker, we must understand our context and use what existed to promote and facilitate COVID. So it's not about creating new structures, it's using effectively existing communication strategy that is already trusted by the people to move this forward. We might not be doing well. If you have any capacity to shout this and make this known, please amplify this and move traction to make it happen. Thank you very much. I'm going to go to Sally. There's a question here that says, look, many Africans living in diaspora has become the resource for many people in Africa in terms of trusted message. How do we factor Africans living in diaspora into the communication strategies for people on the ground in Africa? Thank you.
Right. And yeah, I did say in the beginning of my talk that for the first time ever, we are all dealing with the same issues. So of course, we've got Africans in Europe, Africans in China, Africans in the US, sort of sharing their concerns, their knowledge and their experiences about what, how they are managing the virus from there. And so that is something that of course is being transmitted to us in Africa, and I think that is a good thing. But then of course there's always the bad side of it, because the impact, the scale and the experiences are not the same. So in as much as we want to of course rely on Africans in the diaspora in terms of explaining and in terms of getting factual information about what the virus is and how to manage it, we also need to be quite circumspect in how we sort of take that on board and communicate it. But once again, I would say to me, I see the social media space as a place where a platform where people are really engaging, and people, it's almost a level playing field for people in the diaspora, in Africa. And I think that kind of healthy exchange about the facts, about the data, I have seen it for me, at least somebody who studies social media engagement, I see that the space is really, really democratic. And so I will see more of that. I would like to see more of that happen, where people are challenging each other and not just taking things from one region to the other as the gospel truth.
Thank you, Sally. I think there are one or two contributions on the field from the platform. One being that we need to find experts who can bridge, the technical details, to what the laypersons can take and run with. I want to throw this to Olivia. From your experience working with AFNET, how have you worked in ways where we are bridging this kind of communication? There's so much technical information that is emerging every day, and yet we need to get people to be updated so that they can take responsible actions for themselves. How have, from your experience, how have you been able to do this effectively? Thank you.
Thank you, Monerike. And I would probably want to say, how good is the public how good is the public understanding of the disease and the mode of transmission? Is there anything we can do? Probably that will answer the question. You and I may know much about COVID, what it is and what is not, but the rest of the people may not know. New information about the disease has been evolving rapidly, like I said. And while this information can trickle down easily in the developed countries or in the cities, in the urban centers, the situation is different in the developing countries and in the remote areas, where IT penetration to the most vulnerable populations is limited. Like my colleagues have said, there has also been the challenge of infodemic, with a significant portion of the population unable to access reliable and factual information on COVID. This has also affected the understanding of the disease greatly, I must say. If you remember, most of the initial cases were reported in the urban locations, linked to major points of entry, mainly airports. And in these locations, there's pretty better understanding of the disease as opposed to the rural locations where fewer or no access they have not had access to the reports. Initial awareness campaigns were urban-centric and largely led by the health workers, and not many people knew even how to communicate. So there's a lot we can do again to increase awareness. My friends have touched a bit of that. Moving forward, what we do, we use the multimedia channels to reach the rural and urban populations. Whole of society engagement is required to ensure that all stakeholders are mandated to actively support and participate in the awareness building. Populations should have access to call centers, and this is becoming increasingly important and available, and online sources of reliable information to those who can. Rumor tracking and mitigation with factual information, we actually have a full department on that. There may still be a challenge due to literacy rates and myths around the disease, but again, we are working to make translations into simpler languages or languages that we increasingly understand. More information is becoming available on the disease transmission and how to keep safe. We didn't have that information, pretty much of that information, when the disease had just started, but that is becoming increasingly available. We need to do a lot more to sensitize, to train, to empower our communities, our individuals, and also the countries. Any chance to demystify myths, do it. Get readily accessible sources of factual information. We need to increasingly be honest, be frank, release information timely. We need to continue to work together with our lead agencies like CDC and WHO to ask the questions that we don't understand. We need to keep everything transparent and open and make messages as simple, as clear, and spread widely. I think that will help increase understanding of the disease dynamics and how we are going to keep each other safe. I think that's my submission to your question.
Okay. I'll ask one more question because we're cutting to the top of the hour, but this is also to respond to people that are asking a lot more scientific-based questions. And what we will do is harvest these questions and use that to develop the next platform discussion. Nana will relate to that. Things around why we're seeing less death in Africa, things around what China-African relationship might be after post-COVID, and those other questions that are a lot more science and not communication focused. Thanks for bringing in the questions. We will harvest it and use that to develop the next platform. Please keep in touch. I would ask the last questions and then summarize, and we'll close the session. And that would go to Dotun. Somebody is asking around what does it mean to communicate about food security and gender-based violence, even as we're communicating about COVID, because this is real for the people at the local level. They would want to hear COVID protection, COVID information, as well as address those their real concern. Thank you, Doctor.
Yeah, thank you, Mo. the truth is that there's a thin line between livelihood and a pandemic, or there's a thin line between shutting down the approach using in addressing a pandemic, which is lockdown, and livelihood of the people. And let me say this, one of the biggest challenges we are having in African countries is that we are not domesticating the approach in solving or addressing the spread of COVID on the continent. We're just doing exactly what China did, what Europe did, and what America did. What did they do? Number one, total lockdown. Of course, lockdown may solve some issue for a period of time. But in a continent where you have about 85% of the people working in the informal sector, and these people live on day-to-day basis. If they don't work today, then they may not be able to eat tomorrow. And countries in Africa don't have the economic power to give a palliative that will solve their problem for a period of time. Then you have to domesticate, each country have to understand that have to domesticate this approach. If not, it may become counterproductive. And that is what we are seeing in some countries, and that is what we are seeing even in Nigeria now. We start having civil unrest, we start having increase in crime, because people that work every day and live based on daily wage cannot go to work, and the palliative measures are not properly distributed in such a way that can go around those kind of people. So we have to understand these challenges and domesticate not just communication, but our approach strategies to make sure that this thing does not become counterproductive in most countries in Africa. That is extremely important. And in Africa, where a lot of countries, about 70% depend on agriculture for their source of livelihood. And we are in the planting season now, and you're saying people should not go out. We are playing with hunger this season and next season. These are things we have to take into consideration. I've seen some countries and some states in Nigeria have started saying, let everybody that will come out in public use face mask. That's good. Some countries or some states have started doing community testing. Let's go into community, identify people that have COVID and separate and isolate them instead of keeping everybody at home doing nothing. These are things we have to start looking to domesticate these approaches. And when it comes to communication, what most countries in Africa are doing now is that they're just giving daily updates, daily presidential briefing, daily ministerial briefing. But we have a whole lot of people that are uneducated that don't even listen and watch these kind of things. That is what European countries do. But in Europe, almost everybody is educated. In Nigeria, the person living in a slum don't even have lights to listen to what the minister says on a daily basis. So we have to understand how to stop this top-down communication strategy and get stakeholders at the local level involved in communication, in palliative distribution, and in proper understanding, proper strategy to address the spread of COVID in Nigeria and in most countries in Africa.
Excellent, Dotun. This is an excellent point to bring our discussion to a close. Dotun's concluding remark once again goes back to where we started. It is a national response, and a national response has to be domesticated. We can get support from the regions, as we are already getting, including AU and African CDC. We can get international support, as we're getting in terms of technical support from UNICEF, WHO, and even those people giving us, materials. But it has to be a national response. Understand your context. And if there's anything everyone that has been here, push for that national context. Second, also concluding from what we've heard is that the information is critical for us to change perception and help people understand so that they can take an informed decision. You can be a trusted source of information because you can access that kind of information on this kind of platform and then engage with others, even if all you're doing is dispelling myths and misconception. Once it springs up, you address it. That is excellent contribution. We cannot ignore it. And also taking from the contributions that everybody has also sent on the platform, clearinghouse. platforms, sharing, so that we can continue to mitigate the impact of this infodemic at this part time, because this is the first epidemic whatsoever that is also happening at the time of a social media era. On that note, I want to say thank you to every single one of you that have joined and stayed on to this hour. I would now hand over to Nana, who will bring the session to a close. Please, once again, every single question that remained unanswered, mainly focused on the science, we're going to address and hopefully use it to design the next session. So I hope to see you at the next session. Nana, I hand over to you now.
So thank you very much, Professor Monique, and all the speakers for this really interesting and thought-bringing discussion today. I would like to thank also the audience for participating, and I really want to apologize for all the questions we didn't manage to reply to today, and hopefully we are going to have another series very soon, and we are going to try to address some of the aspects we could not address today due to time. I want also to thank the African Professionals for Progress and the GET Plus for helping in organizing this, and in particular Wilfried Elegba, which is the secretary of the APP, and Dr. Changwi Cynthia, which is from the GET Plus. On this, we will keep in touch with you to tell you more about what is coming up next from us, and I wish you all a very good end of your day, and I wish that we get to talk again. Thank you very much.